Your fitness tracker could soon become your sickness tracker. Early data suggesting those wearable devices might be able to detect coronavirus symptoms before they appear. Fox News correspondent Ashley Strohmeyer explains how the fitness industry is hoping to help curb the spread.
Fitness trackers could soon play a key role in the fight against COVID-19. Researchers around the world are racing to discover whether gadgets like Fitbit and Apple Watch can detect early stages of coronavirus. By monitoring changes in heart rate, breathing rate, and temperature, these devices may be able to flag the illness days before users start showing symptoms. One study out of Stanford University found smartwatches identify early signs of infection in 80% of coronavirus patients.
2/3 of the time, we can tell when someone's getting ill before at the time of symptoms. And we just think that's super powerful. That means 2/3 of the time, you can tell people to stay home, don't go out and infect other people.
The sports world is already getting behind the movement. The PGA Tour partnered with Whoop to provide smart bands for players, caddies, and media during golf tournaments. And the NBA is teaming up with the Oura Ring to keep players safe as the basketball league restarts in Orlando.
I think it's just given everyone more peace of mind and more safety to be able to, look at their app every morning and know how they're doing.
Fitbit is conducting its own study with 100,000 of its users. The goal is to roll out a new feature to help detect asymptomatic patients and ultimately control the spread of the virus.
Ideally, we'd like to try and put this into some sort of program or feature that people could use to actually detect early signs of COVID.
The tech companies stress these gadgets are not medical devices, but can be a powerful tool when paired with other forms of mitigation. Ashley Strohmeyer, Fox News.
The Centers for Disease Control is updating its quarantine guidelines for COVID-19 patients. The agency now says patients with mild to moderate symptoms can come out of isolation after 10 days instead of 14. They also no longer need a negative test in order to return to work or other activities. The change comes after studies showed the large majority of COVID patients were no longer infectious after 10 days. The CDC says those with more severe illness may need to quarantine for 20 days.